Welcome to the AUANews Inside Tract podcast. Today's Inside Tract podcast is part of the AUA Census Trends series, which is brought to you by the AUA Data Committee. This series explores key insights from the AUA Census, highlighting how data informs workforce trends and broader patterns that shape the future of urology.
Hello, everyone. Welcome to AUANews Inside Tract. My name is Corey Del Bianco, and today I'm joined by Tejal Patel and Dr. Kraft, who are the AUA 2026 Best Poster Winning Research. They're in this episode going to explore an issue with major implications for the future of the urology workforce, retirement planning. Their study, Understanding Factors Associated with Urology Retirement, Insights from the 2024 AUA Census, sheds light on the factors influencing when and why urologists choose to retire. Thank you both for joining me today.
Thanks to you, Corey.
So tell us a little about both of yourselves and what inspired your team to look at retirement planning among urologists and why this is an important workforce issue right now.
Yeah, so I'm a current medical student at the University of Michigan. I'll be applying into urology this fall, but I got looped into this research with Dr. Kraft just because urology is experiencing a workforce shortage currently. And there's really been no recent research done kind of looking at what influences retirement for the urologist. So this was one of the first studies that kind of helped delve into that a little bit. And the hope was that some of the findings from this could help influence workforce planning or policy initiatives that could help retain urologists or maybe influence increase in like urology residency numbers and spots.
Yeah, and I'm Kate Kraft. I'm a pediatric urologist practicing at the University of Michigan, and I also have the privilege of chairing the AUA Workforce Task Force. And that really arises from a passion that I have for protecting our workforce so that we can better serve our patients. And as Tejal said, we really haven't done a deep dive into the factors that we need to take into consideration with regard to retirement, those leaving our workforce. We've done a lot of research about those entering the workforce, but now we need to look at kind of the outflow. And I really want to give a shout out to Tejal. She's done an incredible job with this work. This is really her brainchild. And for those of you who are involved in the residency application process, keep an eye out for this superstar.
Thanks, Dr. Kraft.
That's great. And, you guys pulled a lot of your data from the 2024 census. So that 2024 census shows that the average planned retirement age is around 67 years old. And just over half of those urologists plan to work beyond 65. What did you guys see in that data that made you want to dig deeper into the reasons behind those retirement plans?
Yeah, so I think it's interesting because when I first saw that, I was like, this, makes sense. The average retirement age in the United States is around 65. But when you kind of take it in the context of what's going on with the urology workforce, it's a little bit concerning. So there's this workforce shortage. We see that the population of the United States is actually aging. So just based on kind of the conditions that urologists see, we know that the demand for urologic care is also going to be anticipated to increase. So we kind of wanted to see, what are some of the motivations that influence late versus early retirement? Are there certain populations within urologists that we should be targeting that we kind of see have earlier retirement plans or later ones? And we also kind of wanted to see how it was people were planning to retire. And this could kind of help even just kind of at the institutional level planning to see, well, how might we be able to change things to support the current workforce and kind of keep them there to help sustain the workforce kind of as plans happen to grow things.
Yeah, as Tejal said, a good proportion of the workforce, if they chose to, could retire tomorrow, right? And so that would leave a huge vacuum with regard to patient care. So being able to do a deeper dive to figure out what are some of the factors that we can take into consideration to prolong careers while still allowing for fulfillment in one's career and still being able to serve our patient population is really important.
Yeah, and I absolutely agree. And another thing that we noticed a little bit of a difference with that census data is a substantial gender difference. So the data showed that more than half of male urologists plan to work past 65, but only a quarter of female urologists plan to do that. Why do you think, or what do you think might be driving that, large difference?
Yeah, so I think that was a pretty stark difference that we noted, and I think something that's really important just since I think the number of women entering the field of urology is starting to increase, and it's been increasing over the past decades. I think one of the drivers kind of touches on not just urology, but like physician workload more broadly. There's actually been studies that have been done that show that women still really carry a disproportionate burden at home, even though they're working full time, even in like dual physician households. So I think that really was likely a result that we need to like support women a little bit more in the workplace, maybe even kind of in those younger ages when they're probably shouldering a little bit more of that responsibility, figuring out ways that we can kind of accommodate family planning, personal fulfillment, things like that, because they were more likely to cite that than their male counterparts in the census as a reason for early retirement.
Yeah, and we know from the literature, not just in urology, but in all medical fields, that women in medicine tend to shoulder more domestic responsibilities. And I think that continues later in life, even as women are considering retirement. They may want to spend more time with grandchildren, or perhaps they have aging relatives that they need to care for as well. And so these are all factors that we wanted to look into, particularly since we know that women are one of the largest growing demographics in urology.
Absolutely. And I mean, tying in that census data, I believe it's 86% of those women said that fulfillment, family considerations are highly influential with that. So definitely very interesting. And, what real world implications do you think this has for workforce planning conversations?
Yeah, so I think, if we're not supporting people earlier, because it was young women that kind of were most likely to cite those factors as reasons for early retirement. So kind of starting earlier in your career with more of this burden is likely to lead to burnout later. And so I think, it might seem like this is just like a temporary problem, but I think it all adds up over time and probably likely causes them to retire a little bit early. They probably feel the burden of like work, their family life, call burden, things like that kind of all add up. And so I think it has significant influences later on. And like Dr. Kraft said, it's like a growing population within urology that we have more women entering in. So we really need to find ways to kind of accommodate that at an earlier spot to kind of prevent burnout within that population specifically.
Yeah, I think that point can't be underscored enough. It's really important for institutions that hire urologists, particularly women in urology, to factor these considerations into their hiring practices and be able to have more flexibility with regard to things like childcare, family planning, flexible work hours, et cetera, so that we can continue to sustain the growth and well-being of our women in urology.
Yeah, and it looks like it's not just women urology that we're having to change these gaps with. We're also seeing that younger urologists, the younger generations, are citing these same things, the personal choice, the fulfillment, and family considerations in their retirement planning. What do these findings tell us not only about, the women, but the priorities of the next generation of urologists?
Yeah, I think there's been like again, not just in urology, but broadly, a shift towards prioritizing more work-life balance. And I think that became like even more clear during COVID when people were at home. They kind of learned how to balance things a little bit better. So the shift is important, and I think for me, the way I looked at it is a lot of this actually plays into health and well-being, which was like the second most cited factor for both the younger and the older urologist. And so I think it all ties into the importance of, the job is important, but we have to support the people that are working there. Without that, they can't work their best. I think making sure they're fulfilled as a whole and not just within the workspace is really important for the sustainability of the workforce.
One of the things I think the Workforce Task Force is really proud of is bringing attention to burnout and the importance of well-being among urologists, and has really led to more and more conversations and somewhat of a paradigm shift in recognizing that those are important concepts in our profession and that we really need to protect ourselves so that we can better serve our patients in the future.
Absolutely. And, burnout is, a huge topic and definitely something I know the workforce, task force has been working on. So, on that topic, your study found that older urologists were more likely to identify call burdens, administrative burdens as influential parts of their retirement decisions. How does that relate to the census findings that eliminating that call burden was the number one factor that could encourage physicians to delay retirement?
Yeah, I think they align pretty well. I think, if that's the problem, that there's this called administrative burden that's really causing burnout for these older urologists. I think kind of finding ways to offload that could be very helpful just for like retaining them. I think even when we looked at like how the urologists were planning to retire, it showed that people don't really want to go from 100% to 0%. Like it was chose that people chose phased retirement as their most likely form of retirement. And so that really touches that, like, they don't actually want to quit their job. I don't think. I think they might just need the support and a little bit more time to kind of enjoy all aspects of life and not kind of be burdened by call and other things. And I think there's ways that institutions can kind of help offset that. So I know some places have been hiring more APPs that can help out with call burden. And I think those are like small steps that can be taken towards kind of reducing that burden on the older urologists.
One of the factors that older urologists cited as something that would help them prolong their careers is the joy in medicine. And so finding unique ways to be able to find that joy, I think is really important. So obviously administrative burdens may take away from that joy. So we need to be able to foster things like passion for education and research and investigation, maybe administrative leadership and other things besides hands-on patient care that urologists find fulfillment in, so that they can have a more sustained and fulfilling career.
Absolutely. And you mentioned not wanting to go from that 100 to 0. There was a strong interest in the census data of the alternative retirement models, phased retirement, part-time work, clinic-based practice without operating room responsibilities. Can you kind of expand on these flexible pathways that are meant to help try to retain experienced urologists in the workforce longer?
Yeah, so I think these pathways just provide flexibility for retirement essentially, kind of, and they all overlap a little bit. Like phased retirement is a really broad term and it can mean different things to different people. But I think having these flexible retirement pathways will be really important for sustaining the workforce. Nothing's going to be done immediately. So, kind of finding ways to motivate people to stay involved in whatever capacity they feel is right could really help offset workload, even for those younger urologists who are maybe experiencing some burnout for other reasons. And that can all kind of be done in conjunction with working towards increasing the number of resident spots. So, kind of working at both ends to help sustain the workload, I think, is really important.
I think it just goes to show that urologists are not just those that take care of patients. While that is extremely important, that also have multifaceted interests.
Looking at all these findings together, so the bigger picture, what are the biggest lessons for practices, health systems, and policymakers that are trying to address the workforce shortage while supporting physician well-being?
Yeah, so I think it's a really tough task to kind of have to address, but it's an important one. So I think kind of the first thing they should realize is that retention is just as important as recruitment. So I kind of mentioned that it's, one solution is just to train more urologists. And I think that that's something that probably needs to be done, but I think we have to look at both sides. So again, we have to figure out what are like the reasons that people are being driven to retirement. And what we've seen here is that it really varies based on gender and generation. So there's not really like a one size fits all solution to this problem. And you kind of have to meet people where they're at. So that can be done broadly, right? Like we've seen there's a gender and generational difference. So kind of targeting things that each group has cited as their reasons for early retirement. But I think also like at the institutional level, like trying to meet people where they're at and figuring how can we help support individuals in continuing to work without having to give up so much other like aspects of life that might be important to them. So I think kind of making changes at each level will kind of be important for increasing sustainability. So the burden should be falling on multiple people, not just one person up at the top.
Yeah, I couldn't have said it better myself. Tejal really eloquently outlined kind of how multifaceted this whole issue is, and that there's no one size fits all approach. And we just need to keep that in mind.
Absolutely. I mean, that really makes sense. So last question, as we wrap up, what's one key takeaway from your research that you hope listeners remember when thinking about the future of the urology workforce?
Yeah, so I think the takeaway that I had that I think is really important is that, sustaining a urology workforce doesn't mean training more people. It means meeting people where they're at. So we have a workforce right now that's really great. Everybody has something to contribute. And the best way we can keep them there is really listen to them, understand why it is that they might feel they need to retire early, and kind of put policies in place that help support them, support their work, the work that they're doing, the things that continue to interest them within urology, and support them as a whole person.
What I was really struck by was just how the message was about the joy in medicine, not just with regard to the aging urology population, but for everyone. I mean, everyone is finding joy in different ways, and so I think we need to keep that in mind.
Absolutely. Well, this was a great, insightful conversation. Thank you both for joining me and sharing these important insights for the 2024 AUA Census for part of our Census Trends series.
Thank you so much for having us.
Awesome. Well, don't forget to take the census before it closes on September 30th to help become a part of important research like this. Have a great day.
This has been AUA Census Trends, an AUANews Inside Tract podcast brought to you by the AUA Data Committee. For more information about the AUA Census, visit auanet.org/takecensus.